Hi everyone, this is going to be another unedited video. Life is crazy and I wanted to get an update out without delaying it any further. So it's going to be an unedited video. As you can see, Apollo's here with me. He is officially 2. He is neutered. He has been cleared to start mobility training. So we will be starting to work on that in the coming weeks, which is really exciting, and continuing to work on his retrieval tasks and pushing buttons and helping me with deep pressure therapy, both when I'm tremoring and with my anxiety. And then also we're working on shaping a seizure response with him. So very exciting things happening in his training. He's growing up and turning into a wonderful service dog and companion, and I couldn't be prouder of him. So as I said, he has officially been cleared for mobility training. And to go along with that, we got his official mobility harness. It is specifically measured for him and for me. This is the chest part, so it sits on him like this. And then this is a rigid handle that he will learn to brace when I push on, which can help me with transfers and things like that. And then this is a semi-rigid pull handle, so I can hold on to this and he can help pull my wheelchair. And then it just has a girth strap and a belly strap. We'll be getting a cape to put some patches on it. He is very excited about his harness and also kind of wants to play. So I wanted to show you that. I wanted to show you that. We're very excited about it. He's worn it and is very comfortable in it, very happy in it, which is great. And Bold Lead Designs, which is where I got it, did a fantastic job making it and fitting it to both him and me. So really amazing product, and I'm super excited to start using it. So that's the first update. The second update is I wanted to talk a little bit about my non-epileptic seizures. If you follow me on my social media, you have probably heard and seen some posts about me having non-epileptic seizures. So they are seizures that they're very real. I have ones where I am both somewhat conscious and then also ones that I am unconscious for. And they don't have the same brain patterns when you look at them on EEG as an epileptic seizure does. But if you watch me have a seizure, it looks very similar to an epileptic seizure a lot of the times. So that's kind of a newer part of my chronic illness and diagnoses. So I will be having both a regular EEG done to see if they can capture some seizures. And then also in early June, I will be going into the hospital for 3 to 5 days and doing a video monitoring EEG where they have a video hooked up so they can see what I look like when I'm having seizures and kind of if anything specific triggered them, and then also see on EEG kind of what my brain is doing. So those will be very informational, and I'm looking forward to having that information and my doctors having that information. Going along with that, non-epileptic seizures a lot of the times are associated with trauma. And so I am currently in a non-epileptic seizure therapy group. I can't share a ton about it because it's confidential, but it's a group of people and a couple facilitators. All of the participants, not the facilitators, but the other participants, have non-epileptic seizures. So I had my first one today and we kind of just got to know each other, but we will be using some cognitive behavioral therapy methods and some other things to kind of start processing things that might be causing our seizures. So I know it's going to be a lot of work, but I'm ready to do that. I'm also started back with a private cognitive behavioral therapist. He was my counselor a few years ago, and I reconnected with him. So I'm very excited about that. And I think that relationship will be very, very beneficial for me. So that's a little bit about my non-epileptic seizures. I don't know a ton about them, but I'm learning more and more as time goes on. Apollo is starting to learn a seizure response. So if I feel like I'm starting to have a seizure, he's learning kind of how to react when I call him over, but I'm in kind of a not clear-minded state. And then he's also learning to help me kind of come out of them with licking me and laying near me so that I can touch him and things like that. And that has been helpful, and he's doing really well with that. So that is the non-epileptic seizure update. My functional neurologic disorder, again, we haven't made a ton of progress, but we are getting me in a lot of different therapies to try and target all the different areas that FND impacts. So like I just said, I'm in individual counseling. I'm in my non-epileptic seizure group therapy. I just recently started back into a FND recovery physical therapy and occupational therapy program. It is a short program, so it's only about 6 months tops. And I work with both a physical therapist and an occupational therapist who specialize in patients with FND and getting them strength and tools to kind of build on and continue to improve. So I've met with them twice. I like my therapists, and I've started some of the physical therapy exercises and occupational therapy things that they want me doing, and I'm excited to continue on that and see what improvements I can get from it. So really, really excited to be in that program, and very thankful that I have the opportunity to be. My chronic Lyme disease and co-infections continue to be very hard to treat. I haven't made much progress on my chronic Lyme treatment for many, many months now. So that's been kind of frustrating, but we're sticking with it. We're not giving up. My doctor isn't giving up. We still have some options to explore. We're just differing our approach slightly. So I have a follow-up appointment with him later this month, and we'll kind of see where we decide to take my treatment at that. So a little bit frustrating on the chronic Lyme disease front, but we knew it was not an easy thing to treat and that it might be a long road for me. So I'm okay with it, and I look forward to continuing to work on treating my chronic Lyme disease. And the last update that I have for this video, unfortunately, I don't have it with me. It's gonna be a couple months before I do. But I am getting a new wheelchair. It is measured for me, and I've tried the cushion out, the backrest out. It's very, very comfortable for me, the frame out. And it's designed to be a long-term wheelchair. The wheelchair that I have is not. Everyone who I've talked to about my wheelchair says that it is not a long-term wheelchair. It never has been. It really is only meant for very short-term use. So the fact that I've been in it for 3 years, it's been a long time coming for me to get a new long-term wheelchair that doesn't cause me pain like my current one does, and helps me sit with correct posture and really use my body to the best of my abilities. So very excited for that. It will be coming in a few months, and I'll definitely do an update when I get it. We are going to be trying to get me a power assist on that wheelchair, simply because I don't have the endurance to go very far, pushing just myself. And Apollo, while he can and will learn to help pull my wheelchair, he can't do it for super long distances. I can't rely on him completely. So if I'm having a bad day, it's not fair to ask him to be the only thing pulling my wheelchair. So we are going to try and get me a power assist for that wheelchair that I can take on and off. I don't have to use, but I can use as an option. So hopefully that will all work out, because it would be a huge quality of life benefit for me. So those are the big updates. I want to start doing more updates again so that you guys see more videos, and post some training videos of Apollo. If you've followed me on social media, you've seen a couple, because I've been doing 100 days of training with him. So I've been posting every day, kind of some of the stuff we've worked on. But I'm hoping to be able to actually, put together a video that shows some of his training, especially some of his task training that he's doing very, very well with. So those are the big updates that I have. May and June are going to be busy months for me as I get ready to go into the hospital and continue with my group therapy and my individual therapy and everything that I'm doing to try and make myself as well as I possibly can be. So very, very excited for what's coming up in the near future. I guess the last thing I'll say is we are thoroughly enjoying the house. It is everything that we needed. It has space for all of us. And we're all doing so much better not living in a teeny tiny apartment and having space and, being able to go outside without going in elevators. So we are all very much enjoying the house and are getting more and more moved in as time goes on. We're almost done moving in. And so that's all I have for this video. As always, if you have questions or things you want me to do a video about, please feel free to reach out to me. I would love to make more content that is of interest to you guys. And, I really want you guys to get a lot out of these videos, but also, be able to educate people about chronic Lyme and FND and non-epileptic seizures and having a service dog. They're all things that are near and dear to my heart and not necessarily super well understood. So I really hope that I can spread some awareness and education, even if it's just to a small amount of people. So I hope you guys enjoyed this video, and I look forward to doing more and getting back into regularly doing videos. I'm glad Apollo was into being in this video, at least some. Again, sorry for his barking earlier. He gets kind of excited and playful when he sees his working gear. And it's something we're working on, but that's why he was barking earlier. He wanted to play with it. So I'm gonna end this video here. Thank you guys for watching. Please like and subscribe if you haven't, and I will be back at you guys with another video soon. Thanks again for watching. Bye!